I can just move. Never mind. Okay. All right. Are we ready? Okay, folks. Sorry about all that. All right. Can you hear me now? We good? Anna?
Yes.
Yes. Okay. Okay. All right. Well, hi, everyone. Thanks so much for coming today. We're really, really excited to share with you the things that Heartland has been involved with related to transition and to update you. So we're gonna, can you go to the next slide and I'll kind of highlight what we're going to talk about, please? Okay, so we are going to highlight some of the key areas that we've been moving forward, and this is the list of them, and we're going to go through each one individually and kind of give you a quick update. Some of you were involved with some of the transition activities, and some of you have heard different presentations, and we probably had some conversations. So we're just going to catch everybody up very briefly and highlight some of the key areas. And then if anybody wants any more in-depth information about any particular area, we can ask a question or get in touch with us, and we'll be glad to talk to you individually or send you some more information. So can you go to the next slide, please? So in catching up to what got us to this point, this is 2014, we had previously really identified some of the issues related to healthcare transition, conducting focus groups and conversations among different members of the collaborative, and with doing literature review and attending national meetings. And we were pretty clear about what some of the issues were, and so we wanted to start addressing them in a very comprehensive way. So one of the first things that we did that came out very clearly from folks was for us to get to know the family's perspective a little more on some of the issues that they were dealing with related to transition. So Richard conducted a family interview study, so why don't you just highlight a little bit of that, Richard?
Yeah, real quickly, we had 30 minutes, and I don't want to force people to go way over, so I'm going to go really quickly in both all the things I talk about. We conducted,
fine, Richard.
as Wendy said, 5 hour-long open-ended interviews. These were with parents of young adults, past teenagedom, people who had been through transition with their young adults. And we asked a number of questions, and it ended up in about a 5 or 6 page report, a few items of which I just felt like were important to give you a basic sense of what people told us. Transition for every one of those families meant panic. And often the word, I didn't know what I was going into. We didn't know what we were doing. And so there was a lot of anxiety around the experience, especially early on. When asked another question about, well, who was helpful? And a couple of, interestingly, there were transition specialists came up, a nurse in a pediatric clinic or pediatric office, but 2 out of the 5 people said no one was helpful. We were pretty much felt like we were on our own. There were several good things that people talked about that worked well once they got things going, but in particular, most folks said once we started trying to prepare in advance, to do things earlier than we'd anticipated, to get ready, then things had a tendency to smooth out. There were far more challenges than there were. When you ask them what was good about this process, you get one or 2 answers. When you ask them, well, what was challenging about this process, you get 3 or 4 answers. And I just picked a couple more generic ones. Typically, the family-centered approach with which they had become accustomed was missing, or in a couple of cases said they felt like it was purposefully ignored. That's one issue. Healthcare, something that I think was unique, I had not heard this before, but it came up very pronounced in a couple of sessions. Healthcare providers were worried about and therefore didn't share information with educators because of the concern with the stigma that would be attached to talking about their child. So if people are interested in, I know Lori has received that. We finished this back in April, maybe May. I'm not exactly sure now. When I went back to pull up a copy. If people would like more information about that, we can certainly share that with them, and Lori's got it. Okay.
Okay, so let's go to the next slide, please.
Next slide.
Okay. So the bulk of the activities last year were around a transition learning collaborative that we did between Heartland and NIMAC regions. And the first we did 3 webinars back the year before in October, November. But last year in January, we provided a webinar to participants about the whole idea of social capital, which we're going to talk more, and looking at what some of the issues that they were experiencing with transition and some of their questions and the things that they would like to address. We came together in a face-to-face meeting in February, and we had total on the collaborative about 55 participants. We had bad weather in February, so everybody didn't come. Some people participated in long distance, and some people connected afterwards, because this was a multi-sequence set of meetings and emails, but we had 2 face-to-face. So during the one in February, we had a youth panel and several family members, and they all participated throughout the collaborative with us. We had Dr. Sarah Gardner from Kansas City, and we also had a transition coordinator participating as well. So it was a very dynamic discussion, and the questions, I have those listed here. What we did was we broke the concept down of how do we build a person's assets, and asked what does it mean for someone to be transition ready, and what does it look like when someone is not transition ready, because we hear that all the time. And then asking folks, if you could do whatever you wanted, what would you do to build the assets of one of these young adults? These were in small group, and then we processed in large group. We also looked at how can we develop opportunities with the adult providers. When you think of an adult provider who's very engaged, what is it that makes them that way? And if you could pursue something from your wish list, what would you do to develop more opportunities with adult providers? So then we looked at briefly, how can we connect those 2 things? When we bring patients and then we identify providers, how can we bring those 2 together, and what are some strategies? Really looking at the functions. We know things have to be done. We know that there are some deficits in trying to make that happen. And so what are the functions, and how might they be accomplished? And who are some of the people that could do them, or what are some of the tasks that could be done? So people really generated a lot of ideas and so many really useful strategies. It was almost contagious of watching all the excitement in the room from all these folks from so many different disciplines participating. So as a result of and then people identified their own personal networks and some steps that they could personally take when they went back home to kind of promote transition. So as a result of this face-to-face meeting, we created 3 menus, activities menus. The first one was building young adult assets, developing adult provider opportunities, and making connections between youth and adult providers. And each one had between 20 and 30 items on there that people had generated, and we had synthesized from the notes to create these 3 activities menus that we sent back out to folks for their feedback, and adding some additional information or ideas if they had any. So if you could go to the next slide, please. Can you go to the next slide, please? Okay. So then we took that and we thought, well, what is it that's the next step? How would these strategies be implemented? And so we had a second face-to-face meeting in April. We had Dr. Iffy, who used to be a pediatrician and then had become an adult provider, provided a great deal of insight as to some of the the perspectives from both sides and some things that would be helpful to do. We also had a youth and transition coordinator panel, and we're really focusing on how can these strategies in the activities menus be implemented, and looking at the perspectives of quite a few people. We had some different individuals who hadn't participated in the first one. This whole process kind of evolved, but the beauty of it was all of the different disciplines and perspectives that were represented. So we had small and large group discussions, again, looking at how can we create these inclusive networks? How can we connect the people that need to be brought together to ensure a successful transition? How can we tackle those implementation issues? And what would it take to take these strategies that are in these activities menus and turn them into actions that benefit the patients that we're seeing? And looking at, well, what could I do? And how can we accomplish this back in our own medical practices and whatever professional role, or as a family member, or as a patient? How can we facilitate this for ourselves or for other people? We also had an activities menu feedback form, so we continued with these activities menus. And some people had, from the last phone call to here, had the chance to implement some of those strategies. Other people continued on after this face-to-face meeting, but they took some of the items that really resonated with them off of the activities menus and tried to implement them, and then they gave the feedback so we could validate how useful that strategy was, how it may need to be tweaked to be able to be effective. So as a result of these two meetings, we came together and we ended up with 92 strategies and ideas that we then broke down into activities and process related to this whole notion of social capital, and that would contribute to transition. So if you can go to the next slide for me, please. Okay, so then we took this information and presented this poster, which I know you can't read, but I think it's beautiful to look at, so you can kind of at least get the picture of it. We went down to Texas to MD Anderson to the 15th Annual Chronic Illness and Disability Conference, and the day before the conference, they have a research symposium. So it was very exciting to participate in that and represent Heartland in that discussion. So our poster was very well received. We had gotten a lot of people that wanted more information and participated in a lot of dialogue. And what was very clear out of that 3 days down in Texas there in the conversations was that we know the issues in transition, but we need to come up with interventions and strategies and evaluate how they contribute to a successful transition, and that's the next step in the field and the direction that we have to go. And so it really reinforced where Heartland was and the kinds of things that we had already initiated, and we're continuing from there. So now, if you could go to the next slide, and then Richard is going to kind of synthesize all the work from that point into the theoretical foundation that we are using to get to where we are now.
Okay, you can read these as well as I, but I'm going to skim them real quickly. Across the board, and for several years now, there's sort of been a consolidation of the generic conditions that people understand are necessary for successful transition. Positive attitudes, clear expectations, patient needs to acquire the knowledge and skills about and for transition. That's where one of the sort of gatekeeper activities occurs there. People say the patient isn't transition ready, but develop a clear transition plan, make transition resources available. There needs to be oversight and follow-up as people make the transition, as they're, especially the transfer, not the transition, but the transfer from pediatric to adult care. That's a particular gap, obviously, but the transition process is much lengthier than that. And then, obviously, engage the appropriate adult providers. So if you'd go to the next sort of graphic slide, that will give me a chance to freelance a minute. This is a fragile system. This system of the healthcare system that we have developed and created and continue to manifest is a fragile one in the sense that it makes it challenging for this transition process and points of transfer in particular, but the transition process overall, pretty problematic for lots of folks, especially the folks we're talking about. So the people in this fragile system that we've identified, and this is a graphic most of you have seen most of before, although I added my two little and big hospitals here. We've got the pediatric side, we've got the adult care side, we've got the patient, family, and the specialist, or that can be plural in the case of multiple conditions. That's the system we're talking about. Okay, next slide, please. In this system, in this complexity of systems, our focus has been on young adults. So looking at all that, the complexity of the players involved in the different roles, where have we chosen to spend our time and energy and take our focus? It's on young adults. Next slide. Okay, one way, and this is going to be a little make-up history for some of you. One way has been that we've taken on is to introduce the construct of social capital, to model it as a way of connecting the parts. And the social capital in particular, building social capital for these young adults. So next slide. Okay, social capital, the sum of the resources that accrue to an individual. This is not only just the resources they accumulate, but it's the process by which they accumulate. And that's what we've really focused on, the process and the products of trying to develop social capital. It's the resources that accrue to an individual, in this case young adult patients, or maybe not even adult yet, still as adolescents, because this process needs to start early as 14, and that's pretty standard response in the literature and in practice anymore. By trying to create a durable social network of more or less institutionalized, which means they're going to have to become institutionalized relationships of mutual acquaintance between the pediatrician, all the players that we're talking about. These people need to recognize and be more than acquainted, but to work together in a much more cohesive way. Okay, next slide, please. Networks, this whole network, this fragile network that we're trying to solidify, and the social capital we're trying to give or construct for the young adult is something that it's not a given. You have to go out there and construct this, and that's really what we've been about for the last 8, 9, 10 months, is trying to find ways to activate this process. Next slide, please. What activities do, in fact, construct social capital? Social capital is helpful to this kind of healthcare transition. The collaboratives and the work we did that Wendy presented and that we actually, or to you earlier, and that we presented a number of times, one of which was down at MD Anderson at the Healthcare Transition Conference, focused on 3 different sets of activities. And this should look familiar to you because it was in an earlier slide. What we're really trying to do is build assets that accrue to families and young adults themselves, develop opportunities to work with adult providers, and then make that final connection, connecting with the adult provider. Okay, next slide. Toward that end, what we have got now, and you'll see a couple of the first few pages of this transition engagement checklist. This is a set of actions, a checklist of activities, a way for someone to sit down and assess where any given individual, young adult and their family, is relative to these 3 major categories. Building, so we've got this checklist, and you'll see the first couple of pages in a moment, a checklist that talks about to get engaged in this transition process. What are you doing to build assets? What is your transition preparation? What is a measure or some estimate of your transition readiness? What are you doing relative to developing transition opportunities, in particular facilitating the actual transition and planning for adult provider contact? And then finally, making contact with the adult provider. establishing that literal contact, and then determining and trying to activate a follow-along or follow-up process that continues, that has some continuity across the system as we're talking about transition.
Yeah, back to me now.
Okay, you want to do this next?
Yeah, the next slide.
Okay, next slide, please.
Okay, so how does this all come together? Well, as like we said, we heard the issues, we got the strategies from folks, but those activities menus were great ideas, but we needed to turn them into a usable tool that could be implemented. And so that's where the idea of the transition engagement checklist came in. The format here, Richard gave you the 3 broad categories and then the 2 subcategories within each one. What you see in front of you is the transition preparation. And what it does is has a series of questions that have been identified as being the important elements of transition preparation to talk with the youth and the family to get their perspectives on these things. And then at the bottom are some strategies or recommendations. These are some direct ideas that came from the folks in a very synthesized way, because we've covered all of the ideas that people gave and processed them into a cohesive format here. And so these are some suggestions that people had. And then below that is the action item for the parent and then action items for the youth as a result of the discussion around this topic with the parent and the young adult. So if you can go to the next slide, it'll give you a second. Okay, so here's a second one related to transition readiness. And again, some questions around that subject, some strategies and recommendations, and then a place to identify action items. At the top, we put a rating scale so that this is something that could be checked off. The rating criteria will be developed as we begin to use this and could be checked off. So it's a way to monitor over time somebody's transition activities as opposed to saying that it has to be done at this particular time. This could be used at any point in time and address these issues that we heard even with the young adults who are in their mid to late 20s and early 30s that were talking about experiencing these and could identify those elements of transition and how they could be addressed. So it's a way to put the youth in the driver's seat to inform families and to inform the youth and to be able to participate. And it continues on with the other sections like Richard had mentioned.
Before we move past this, I just want to make sure you recognize that the items under what it means to be transition preparation or transition readiness, those items emerge from the work we've done with the collaborative earlier, as well as the strategies and recommendations. So both the activities that you're asking about under the prep section, as well as the strategies and recommendations, came from that conversation. And we really want this to be a youth-driven process. So while we know the parents are going to continue to be involved, we really want action items for the youth to be determined as well.
Okay, so now let's go to the next slide, and this will all come together in the end. But we're going to give you all the pieces here because it's pretty exciting how these pieces are fitting together. So the medical education, when we looked at the notes from the collaborative, education was one area that kept coming up. And in fact, some of our recommendations that did not fit on the activities menus were around the idea of medical education. And so we began addressing that, and we have started a healthcare transition component of the adolescent rotation for the medical residents here. Yeah, the pediatricians. So this is something new that's been added. And so we have a menu of activities that we are compiling for each of the individual residents that we meet with. We have one a month, and so far we've met with 3. So we have didactic meetings. We schedule interviews with parents. We schedule time with young adults. We schedule time with individuals approaching transition and those who have experienced and are on the other side. They have observations and they site visits with adolescent physicians, with genetics clinics, and with the adult service capacity, going to education settings, going to individual apartments and employment sites, so that people are seeing the pre and the post, what's possible, and with an emphasis on youth with genetic conditions and in addition to youth with special health care needs. So the goal here, they're listed there of what the residents will achieve as a result of participating in this, to gain a better understanding about transition, identify the roles and responsibilities, to determine some of the strategies that are helpful, to figure out ways to include parents and youth in that transition process, and strategies for problem solving. We also have a list of resources and reading materials for them. So we've gotten really positive feedback. We've let it evolve as it goes. We started creating it, and it's very much become entrenched in the medical program here now, and we're going to continue through this next semester, and then we will finalize a few of these pieces. But this is what we have put together so far. Now, if you can go, before you go to the next slide, one of the challenges that we've experienced with doing this is that we want the focus to be on transition, and it's been very difficult to orchestrate time within the adult provider practice, within the pediatrician practices, within the genetics appointments, to hit it at the time when a transition meeting is being held. And so we can talk about it and we can have some observation, but they're not all getting that experience of actually seeing transition being discussed. And so if you can go to the next slide. We are responding to that by creating a transition consult. So the whole idea here is that we will use the Perry Center simulation here at the med school, Sanford School of Medicine, and we are going to create the situation using, we write scripts, we set up scenarios. They use actors at first when we test it out to very begin with, but then we will bring in real people, parents and young adults, to participate. And the resident will then discuss transition with these individuals. And that person will use that transition engagement checklist as a way to guide that discussion, as a way to provide feedback and to give the family member and the youth something that would be a useful guide for them to help them with their transition as they go back to their primary physicians. So the purpose of this consult then is to test out the use of this transition engagement checklist, to identify, to pull it out of the regular practice because of the issues that we hear about with time and non-billable activities, and when and where and how do you bring it into the regular medical appointments. So if we can pull it out, we can implement it, figure out how it works best, come up with a protocol, pilot test it, and determine the efficacy of using that tool and getting the feedback both from the pediatricians and the specialists and the adult provider on how that works. And it's interesting because we've already gotten like 4 referrals for this consult that we haven't even started yet, just because of word of mouth that people are hearing about, of not even the simulation. I mean, real people being referred for the consult. So did you have anything?
Yeah, I think the Perry Simulation Center is an amazing facility. They have lots of mannequins that do everything except get up and walk. and they videotape everything. We're really going to use this as a learning experience for the third-year resident in pediatrics in their adolescent rotation. The whole thing will be that interview using the transition engagement checklist will be videotaped. We'll go back over that with the third-year resident at some later point, sooner rather than later, obviously, but won't be the same day. And it'll provide us an opportunity to build a tool, and the Perry Center folks are really excited about this, to build a tool for medical education that we can continue to use. It's not just the tool that we've got, the engagement checklist, but this whole process of teaching this content and process to the third-year residents in pediatrics. So it's really, the Perry Center is pretty jazzed about this, and it's very unique to what they've done up till now.
And it's kind of exciting to see how all these pieces have fit together and what the face-to-face meeting and the generation of all those ideas has resulted in something that we have received social validation from, sending it out multiple times, and people providing their feedback. So if we can go to the next slide, almost finished here. Just to highlight the research that we are proposing to do fairly soon here. We want to, the other perspective is that we have not talked directly with adult providers, and so we're working on the logistics around conducting that study. The second thing that we have going on is the feedback we also received from people were the perspective of youth, and hearing from them what they kept saying over and over in the panel discussions and the involvement they had was really not feeling comfortable engaging, that they didn't have the relationship with the new physician. They didn't feel prepared themselves. So we have a student who is out, a young student who is from the University of South Dakota, who is going out to meet with youth and talk with them about, if you could ask questions, what is it that are important to you? What kinds of things would you like to find out from your doctor, that we can come up with kind of a cheat sheet, maybe, if you will, that youth could use to some generic kinds of things that cross over everyone and is in a usable format. So these youth are participating both from school systems and from the adult providers, so that we are identifying youth with genetic conditions and youth with healthcare, special healthcare needs, to provide this input for us. So that is coming, and we'll develop a tool from that. The transition engagement checklist tool that we described here, we're going to be using it with the resident education. We've talked about doing a Delphi panel, and which would provide input from folks, and if not, maybe a different study, and use that for something else. And then the transition consult that we're doing, we want to evaluate that and do some kind of implementation study, either in the simulation or then break it out and actually do it through the Center for Disabilities here and implement that. The last slide then, if you could go to that, please. Okay, so the products out of this, the Learning Collaborative Package, all of these pieces, we're compiling all of those and have that to you this week, Lori, that puts it all in one cohesive group. We will have the transition engagement checklist once we've tested that out a little bit more. The resident education transition curriculum, we've already sent a summary of that, but again, we've created the menu, and then once we are able to implement it with a few more residents, then we will finalize that. The patient interaction tool, which is what we're calling the youth questions, but you know, that can change, but that's our working title for it right now. And then a protocol for the transition consult. Do you have anything to
No,
add?
I think the transition consult really connects right back to that engagement checklist. It's an activity that we talked about becoming part of the routine of life here in the Center for Disabilities, is providing a transition consult for folks across the state of South Dakota, utilizing this tool. We need to test it, and even though you only got the first, it's a 6-page tool. You saw the first 2 pages. The other 4 pages exist. We just didn't want to put it all into this presentation today, but we've got it, and we're going to start testing it.
Oh, and the final piece that Richard was mentioning there is we envision that transition consult, and our goal is this year to use a telehealth modality to be able to bring that consult to rural areas and to bring the whole notion of transition to smaller communities. And that's on the radar. We have the technology. We're implementing the telehealth in 3 other areas, and this is one that we want to do as soon as we get past that simulation, where we can have a more controlled environment to test it out and then do it locally and then try and extend it out. So, okay, so we really have gone over here, so because we started so late.
Yeah.
We're really on time, but we started late.
Yeah.
We're on.
We didn't have 35 minutes, but just started late. Thank you.
Okay, well, thank you all very much. And Anna has unmuted all of the attendees, so I do want to allow a few minutes for questions. Everyone should be unmuted, so you should be able to verbalize your question.
Can you hear me?
Yes.
Yes.
Okay. Hey guys, so kind of in follow-up of our phone conversation then, given kind of the time constraints on the Heartland's part, what part of those items you just went through do you think are doable within the next 2 years?
All of them.
All of them.
Planning on this year.
Okay, perfect. All right, thank
We've
you.
got a timeline mapped out for all of them, and we've already started on all of these, so we're in really good shape to I think, over the next 6 months. The initial next steps on all of these, like the piloting and everything, which would lend itself to a much larger kind of study or telehealth or something to that effect, the second 6 months on all of these items.
Okay, perfect. And then the second question that goes with that is that out of all that, are you guys on autopilot, or what do you need from us to help make those things move forward as well?
Well, we always love to brainstorm the input, but we've just we've been following through with what the Learning Collaborative people said, so it'd be nice to huddle and have people's input and if they have suggestions, but that would be terrific to do, but we were just following through with the suggestions from up to this point, so. And we've had conversations, we've been sharing with Lori, but
There isn't anything called autopilot around here. I'm sorry to say.
Well, particularly at the temperatures you're operating at.
Yeah, you got to keep moving, or you'll freeze, you'll freeze in place.
the biggest thing that the next step for us was working with Lori to identify who those adult providers would be for the interview. That would be the first thing. The resident education and the tools implementing that, we can do that locally here with the Perry Center, and so it'd be great to troubleshoot and brainstorm and with you after as we're moving forward on that. But then after we finish these in-house over the next few months, where we go next and how we branch out to maybe multiple states or outside of where we are here locally, then that would be really helpful to be thinking about what you would envision that to be.
Yes, and we will be doing that, and I'm seeing applicability as well for genetics resident programs and genetic counseling training programs. Okay, due to the interest of time, so if anyone has other questions, of course you can contact Wendy and Richard directly. I do not yet have the list of names of everyone who's on the call today, but for those of you who were a participant in the Learning Collaborative last year, we appreciate your contribution, and we will be hosting actually another one of these sessions again for that group. For those of you who are members of our clinical services work group, I invite you to stay on for the remaining 7 minutes of this call. Our next agenda item is to